guys, my name is Erin. I'm a physical therapy student from Drexel University, and today I'm going to be taking over Dr. Alina DeSouza's page to talk about patellofemoral pain syndrome. I'm also going to be showing you some of our favorite exercises we like to try when dealing with this type of pain. So patellofemoral pain syndrome is essentially an umbrella term used to describe pain felt on and around the front of your knee. Patients with this typically report an increase in pain with things like going up and down stairs, squatting, running, and sitting for long periods of time. So as you bend and straighten your kneecap will move back and forth within something called the patellofemoral groove. In order for it to move optimally, the soft tissue structures that attach to the patellofemoral joint will have to have optimal flexibility as well as adequate strength. So our big muscles in the front are our quadriceps, and they're the primary shock absorbers for the knee. They also help control the patella. So while it may sound like strengthening the quadriceps alone is the obvious fix, in physical therapy, we will address your entire lower extremity, so your hips, feet, and ankles are included. We'll be looking at the mobility and strength in all of these muscles, as well as watch how your patella tracks within the patellofemoral groove as you move, and watch your form, so watch you do things like running, squatting, jumping, and landing. For you runners out there who are experiencing this type of pain, a significant increase in training volume each week without progressing appropriately, a change in training surface, or a change in training elevation can all lead to patellofemoral pain. So before we get into these exercises, I just want to say that while these exercises work well for some, they may not work well for everyone. That's why going to a physical therapist is so important. A physical therapist can help create a plan that's well suited for your strengths and your goals. Our main goal in physical therapy is to address all the factors that may be causing patellofemoral pain syndrome in your case, as well as help improve your knee's ability to handle the loads placed upon it so that you can get back to running, squatting, going up and down stairs, all pain-free. All right, let's get to it.
Okay, so the first exercise is sit, lock, and load. This is one that we like to start with. This can be done for 2 sets of 10 reps. Start by holding in the leg that you are not working and straightening the leg that you are working. Squeeze the quad in this position and lift the leg up, over, and back. Ensure you keep the quadricep muscle engaged the entire time by not letting your knee bend. The next exercise is Spanish squats. First, you'll anchor a heavy band to a sturdy surface roughly around knee height and place the band around the back of your lower legs. Now perform a squat while leaning into the band and keeping your trunk straight. The idea is to keep your shins close to vertical in the bottom of the squat, and as you come up, think about leaning slightly back into the band at the top. Try your best to avoid leaning your trunk forward by really focusing on leaning into the band. This will ensure you keep constant tension on your quadriceps. The third exercise is wall sits. Begin in a standing position with your feet about hip width apart. Next, with your back against the wall, lower yourself about halfway down to 45-degree knee angle and hold this position. As this gets easier and you have no pain, you can increase the amount of time you hold this position, or you can attempt to squat down a little lower and hold. We typically go for 30 seconds, 3 times. The final exercise are lateral step downs. Start by standing on top of an elevated surface. Shift your weight to the leg you are working. Begin to bend your knee and hinge forward at your hips as you straighten your other leg down to the side of the surface. Once you have reached a point that is as low as you can comfortably go, push back into the surface and return to the single leg balance position. Try not to twist your body as you squat down on one leg or let your hip drop to touch down. Go for 2 sets of 10 reps.
Hey guys, I hope you enjoyed Erin taking over and showing us those 4 awesome exercises for patellofemoral pain syndrome. If you have any videos you want to see in the future, be sure to leave them down below. Always remember, exercise is medicine, and I'll see you in the next one. Bye!